Chapter 8. A case of leukocythemia or leukemia, splenic anemia. That remarkable naturopath, the late Louis Kuhn of Leipzig, declared that disease was a unity and with trifling variations should be always treated in the same way. He maintained that all diseases, no matter what their names or sites, invariably rise from the same cause, viz., an encumbrance of foreign matter in the body. He said it was absurd to treat an organ separately, as specialists often do, for, as goes without saying, any organ or limb is a part of the body, and to think to cure an eye, an arm, a leg, or whatnot merely by treating it locally is the height of pseudo-scientific folly. If an eye is diseased, there is something in the body itself which is causing that disease. For instance, he gives the case of a woman who was going blind. He treated her whole body, ridding it of its cloggings, and the eye trouble cleared up automatically. She had suffered for years from bleeding piles, the orthodox physicians having finally operated on her. Soon afterwards, she started to lose her sight. The safety valve had been blocked up by this measure. The operation, declared Kuhn, and the poisons went to her eyes. See the new science of healing. Kuhn effected many remarkable cures by his method, but would have effected even a greater number had he known the value of urine as a means of replacing wasted tissue. Yet he was right when he declared that all diseases, except those caused by traumatism or structural defects, could be cured by one means, as I myself have demonstrated. The name of the disease is of merely academic interest, and has nothing to do with the curing of it. All the same, for the sake of convenience, and to prove this fact, I have advisedly specified the diseases treated, and will now give the case sheets relative to what is termed leukocythemia or leukemia. The patient, Mr. P.C., was brought in a taxi to my house by two of my disciples, under quotes. He was too ill to walk into my room unsupported, looked very pale and wretched, and altogether was obviously in a very bad state. His age was 48. He had lost 4 stones in 1 year and another stone during some weeks of medical treatment. After I had examined him, I said in effect, Mr. P.C., your condition is medically tabulated as leukocythemia or splenic anemia, and according to the medical profession, you have but 3 months to live. Your disease has been brought about by an ill-balanced, denatured diet. Nonetheless, you can be saved by fasting and urine therapy. Under quotes. I went on to explain the details. Then he told me his story. The gist of it was as follows. Shortly before Easter of that year, 1927, he had developed a cold, for which he had doctored, under quotes, himself. By the Good Friday, his condition had been such that his wife and his brother had become alarmed and sent for a young physician who had diagnosed high blood pressure. On a second examination the following day, however, he had said it was not high blood pressure after all, and that he had found traces of other symptoms which he did not particularize. A specialist was then called in. He examined the patient, pointed out the region of the swollen spleen to the general practitioner, and diagnosed the case as leukocythemia. Mr. P.C. was then informed that the disease was rare in England, and asked if he had ever been to the East or the tropics. His relatives were told that the malady always proved fatal, but that the patient might live from 3 to 6 months if given deep X-ray treatment, drugs, and a series of injections. No mention was made of diet, except the liver would be good for the patient. Mr. P.C. accordingly attended at the local infirmary, where he was examined at various times by the visiting physicians, who became interested in him as a somewhat rare specimen, under quotes. All of them were unanimous as to the name of the disease and the length of time the patient had still to live. His blood was tested by the staff pathologist and registered at 556,000 more white corpuscles than red ones per cubic millimeter. That was the position when Mr. P.C. was brought to me 5 weeks after the disease had been given its polysyllabic and high-sounding name. Mr. P.C. was not an easy patient and was not prepared to fast without interruption as long as a period I considered essential for his grave condition, which had been complicated by all the medical X-ray treatment he had undergone. However, although he only fasted a few weeks, during which he was robbed with urine by his wife and friends for lengthy periods, and of course, he did not omit the essential part of the treatment, the drinking of his own urine. He was so far improved that he could walk into my house unaided. Indeed, his improvement was so marked that, under pressure, I consented to his breaking his fast, provided that I should dictate what and when he should eat, and that the rubbings and the intake of his urine were not discontinued. His food during the next week was to consist of fresh raw fruits, apples, oranges, and bananas chiefly, salads, tomatoes, steamed vegetables, potatoes in their jackets, fresh uncooked, unpasteurized milk, and honey, all of which were to be consumed in small quantities. Later on, he was permitted steamed fish, meat, etc. In short, a well-balanced diet minus tinned meats or twice-cooked meats of any sort. He was to continue to drink his own urine. All this he faithfully carried out. 6 weeks from the day I first met him, Mr. PC had a further blood test. This revealed that whereas the blood count had previously been 556,000 white corpuscles in excess of red, it now showed less than half that amount per cubic millimeter. Mr. PC was so cheered by this report that he consented to further fasts of a week's duration. Thus, during the next 6 weeks, he underwent fasts of 7 days each. The third and final blood test revealed that the blood content was quite normal. Soon after the 12 weeks in, all of the vigorous treatment were ended. Mr. PC was back at work, a well man. Nevertheless, the story has no happy ending. Despite my having impressed upon him that his condition had arisen through an ill-balanced, rubbishly diet, in the course of time, as I afterward learned, he reverted to his old habits of eating just any mess he fancied, under quotes. Although for 2 years after his penance and while he kept up rational feeding, he did not even have one cold to contend with. After those 2 years, he gradually began to backslide, and although he had a few boils and colds by the way of warnings, he paid no attention and finally died during drug treatment for influenza 6 years after his recovery from his grievous illness. Truly, the way of the transgressor is hard, under quotes. Apropos of Mr. PC's case, I was destined to lose any old school friend through the same fatal medical treatment for splenic anemia. He had for some time been undergoing deep x-ray for this disease, and learning of my success with Mr. PC had resolved to undergo the fasting and urine cure. But it was too late. He died in his own house, attended to the last by well-meaning but alas deluded professors of the healing art who thought that science was mightier than nature.